Hello, everyone, and welcome to a new episode from Reframe Your Health. I'm Dr. Labib. Beside me is Dr. Yusuf. Today, we're going to talk about a very important topic that we've been asked to talk about on multiple occasions. And the topic is menopause. So, this is a taboo, unfortunately, a taboo topic that, many women suffer from and don't talk about. Providers and physicians also don't, some of them are not trained in taking care of women in menopause. So we're going to start by defining what menopause is, and then, discussing, how to transition women through that phase of their life.
So thank you, Labib. Menopause, we've always been taught in textbooks and med school and residency that the definition of menopause is not having menstrual cycles for 1 year. Now, I absolutely hate this definition because it doesn't justify it. It doesn't give it its the attention that it needs to receive. Because menopause is, unfortunately, it's not an on-off switch. It's not that women wake up one overnight and somebody turns off.
And it doesn't explain how it happens.
Right. And we know nowadays that the average age of menopause, by definition, is 51 in the United States. It varies from one place, one country to another, depending on their genetic background, depending on different variables. But the changes start happening about 7 to 8 years before the age of menopause. So imagine I'm going to tell you, in 7 years, something is going to happen to you. But from now until then, you're going to live in complete vagueness. Whatever happens to your body, whatever, you'll figure it out. But once you get to that stage, come back, we'll fix it. Completely wrong, completely unjustified. How we have been dealing with menopause and how menopause happens. So it's a gradual decline in what the ovaries do, and that takes us to the next thing. Why does menopause happen? So we know menopause happens mainly because the ovaries slowly and gradually over time they stop producing important hormones.
Yeah, and one important thing that you were talking about, that a lot of the research that's related to women's health is not done in menopause. If you look at PubMed, which is our go-to library for publications, a big chunk is related to women in the reproductive age group during pregnancy. But when it comes to menopause, compared to that amount of research, we have little bit of research
Why
in
is
menopause. That? I don't know. It's just like maybe a phase that people don't want to talk about. Us, when we're in training, also, we are not exposed to a lot of menopausal women. So we are maybe not comfortable taking care of menopausal women, and it's across the board and everywhere in the world. As trainees, as doctors, as healthcare workers, we're not exposed to menopausal patients.
And women in the past didn't used to live as long as they do right now.
Exactly.
So that phase of when people get to menopause was looked upon as something natural. It's the natural process. Yes. It's okay.
And deal with it.
You don't have to deal with it. Yeah. And me growing up as a child, I used to see my mother and my aunts, their expectations and how they look at things is that, menopause happened.
They're
good.
Doomed. They're doomed.
And then we're finally done with bleeding. It's something gone, which unfortunately because of the way people were brought up and how menopause have been approached, many bad consequences happen to women.
Exactly. And now we know, like you said, women didn't live that long in the past, but now with advancements, so women live longer. But we know also if your ovaries stay functioning longer, you will live longer. So if your habits during your lifetime were healthy, you don't smoke, you don't use any drugs, you eat healthy, you exercise, you sleep well, your ovaries will function for a longer period of time, and then your lifespan will be longer. And yeah, now women have careers. Some of them start businesses and go to college again in their menopause years. So they need, their cognition, they need their physical, their emotional well-being. So yeah, menopause is an extremely important phase. It is a big part of your life. And remember, we're talking about, when you say menopause in Arabic, for example, menopause, the word menopause is translated to an age of hopelessness. So, which is a very ugly word to use. On the contrary, this is a time where women can be even more functional than they were in their 30s peak. And 40s. They're more mature, they can have careers. So again, so we defined what menopause is. So it is like a transition. It's not an on-off switch. It can be also actually defined through blood testing, but it's more related to the symptoms. And something important Dr. Yusuf mentioned is that changes start happening years before. So let's explain what are these changes and why are they important.
So changes start happening in what we call the late reproductive years. There are very subtle signs that start happening in the woman's body and how things change that start to reflect the decline in the amount of hormones that are produced by the ovaries. So a lot of times women in their early 40s, they start noticing that their cycle is starting to get shorter. And their mood is a bit different. Their sleep is a bit different. They're unable to sleep as they used to. They're more anxious for some unexplained reason. I have people complain to me that they're just anxious. They wanna find a reason to fight with somebody, but they don't know why.
Yeah.
And all that starts because of the amount of hormones that the ovaries are producing is slowly going down. And we're mostly looking at three main hormones: estrogen, progesterone, and testosterone. So all these three start to go down and decline as women get older and as these ovaries get older. So everyone is born with a specific amount of eggs in their ovaries. And these eggs, every month, we lose a small chunk of them. And those eggs are responsible for producing these hormones. Yeah. And as we lose these eggs, the amount of hormones slowly goes down and down until we get to the point where there's none of that. So that's why they start to gradually feeling symptoms. And then as women approach menopause, more and more of these symptoms become apparent, and more of the symptoms that are commonly known as menopause, when people have like night sweats, hot flashes, vaginal dryness, lack of sexual desire, and among others.
This is when it becomes when your estrogen is very low, when you get these hot flashes. But like Dr. Yusuf was saying, changes do happen years before, and these could be hidden, because there's receptors in our bodies, like in every organ, there are receptors for estrogen and progesterone, and as well as testosterone. So like the cognition starts, declining, the blood vessels, which is extremely important, because when women hit menopause, the estrogen is so low, the risk of cardiac diseases or strokes becomes higher and almost equivalent to men. So there are hidden symptoms and there are obvious symptoms. But when you see the obvious symptoms, the hot flashes, the vaginal dryness, we are almost at an advanced, stage of menopause. So very important, and this is one of the first messages we like to tell women, that if you feel those changes, those mood changes, the sleep, you're not energetic anymore. Like at the gym, you're feeling you're exercising and you're not gaining muscles, and your body is changing, you're gaining fat in abnormal areas. This can be maybe an early sign. Go check, ask. You might be a candidate for replacement or other things that we'll talk about in a second.
I see a lot of women that come tell me that in their entire life they never had to go to a gym and lift weight, but now they feel like they need to go and lift weight because their muscles are getting more laxed, everything is becoming more laxed. And obviously this goes parallel along with the amount of estradiol and testosterone.
And they keep exercising and they're not seeing good results. And one of the important hormones you just mentioned is testosterone. And testosterone is known as the male hormone, but honestly, women do produce testosterone. It's super important. And if you take like the level of testosterone in a woman's body by the units or by the amount, they have more testosterone than estrogen. So we cannot ignore testosterone. It's very important. We'll talk in a bit, about whether you need to replace it or not, but it also declines, and it's going to affect everything from your muscle mass to the fat distribution, to the cognition, sexual desire. All this can be affected by testosterone. And then also the other hormone, which is, the cortisol, which comes from your adrenals, can be also affected when the estrogen changes. And that's why women become anxious. Some of them get depressive symptoms too, and they might have crying spells. And so it's all related together.
So symptoms-wise, what do women start feeling when they're in this transition from perimenopause?
Like you mentioned, it can start first by their cycle shortening. They might have beginning of some vaginal dryness, not sleeping well, the mood swings, and the irritability. Maybe some depressive symptoms, unable to concentrate. They would be sitting on their laptop and they would forget what they've done a second ago. So this is how it starts gradually until they reach where really the estrogen is so low that they can get more severe vaginal dryness, sometimes frequent recurrent urine infections. If they have also some issues with their pelvic muscles, they can weaken and have more pelvic prolapse. Which is a major problem too, and then the hot flashes. Which are annoying. Again, not every woman will suffer or will go through all these changes. It all depends on your genetics and on the amount of estrogen dropping and how the estrogen is metabolized in your body. But this is these are the common symptoms, or it can be a combination or one of them or all of them, unfortunately. So hot flashes. So why do they happen and what do they mean?
Hot flashes, you mentioned, they're annoying. For me, they're dangerous because the worse the hot flashes, the higher the risk of a woman getting heart disease. The chance of them getting heart problems, problems in their blood vessels increases with worse hot flashes. So they happen because estrogen has receptors everywhere in the body, from head to toe. So the role of estrogen is to deliver a message, is to trigger a response anywhere in the body. So if you take it out, that response is gone from head to toe. So there are temperature regulators in the brain that have receptors for estrogen. And with the decline of estrogen, women start having these hot flashes. Now, I term them dangerous because with time, as time advances, they slowly go away. But obviously the hidden dangers of menopause don't go away. The risk of heart disease doesn't go away.
So they have an issue also with with their vasculature, whether in the brain or whether in the heart. And estrogen is very important for the flexibility. It prevents plaque from forming and getting a heart attack. So yeah, if you're having hot flashes, don't ignore them because they can be, like Dr. said, dangerous. Not only annoying but dangerous.
So women who experience hot flashes in the evening, who were studied and had MRIs done on them, at the moment of the hot flash or the flash, there is low or less blood flow to the brain.
Yeah.
So with each hot flash, there's less flow to the brain. So if I could tell you I'm going to stop the blood flow to your brain right now, imagine what will happen. You're not able to focus, no concentration. Obviously, you will have brain damage. Ultimately, you will have dementia. Your brain will start losing its function. So that's only one aspect of it. Now,
there's one thing we used to always ask students about it, whether we call it flashes or flushes. I think maybe flushes will reflect more because they really flush. A flash is maybe a bit quicker, but flushes are really they can be bad. I mean, women can wake up in the middle of the night sweating, the bed is wet, they are annoying. So now that we defined some of the symptoms, we defined how menopause happens, we spoke about the hormones that are affected, what are the options and what should we do? And because I think this is the main question.
The main question is, what are the options? The first message that I want to get over to the listeners is that don't be afraid to seek treatment, to ask somebody who knows how to treat menopause. Because we know why it happens. It happens because, unfortunately, up until now, the ovaries have a certain age. And once they've reached their limit, where they don't produce any more of these three important hormones, we get into menopause. As of now, the best thing is to replace these hormones.
Exactly.
Majority of women are candidates.
Exactly.
Although some women are not candidates, and some women prefer not to take hormone replacement. But the scary thing about hormone replacement stems from one study that was done in the early 2000s that basically looked at women who received estrogen with progesterone, and then looked at if they were had benefit and what side effects happened. So obviously that study had to be terminated early because of the side effects. And from that, when we were training, we were always taught that if you want to give somebody ever some treatment, give it the lowest dose possible, shortest amount of time, and then that's it.
Yeah, this WHI study, it can take us another episode to dissect it, because it was a very, well-designed study, but it had a lot of flaws. The average age of women in the study was higher. It was like 63, the average. The type of hormone used was also different. We're going to talk about it in a second. But like Dr. Yusuf said, hormone replacement is very helpful. It's probably one of the best things to revert those symptoms and improve health in general. But this is the biggest question. Should I take hormones? Should I not take hormones? Most people are candidates, but not everyone. So this is the second important message we need to talk about, because our genetics are different. We might respond and metabolize estrogen differently, but I would say most of the majority are. So should you take hormones or not? And what are the hormones you would give? And also the question that will come after this, should we use synthetic hormones or bioidentical? Because I think these are the two questions that we get mostly about menopause.
So the first part of this question is what type of estrogen should you use?
Yes.
The estrogen that was given for women in that study that we had mentioned earlier is not the same estrogen that their body produced. Mm-hmm. It was a type of estrogen that was extracted from or made from the pregnant female horse, and it's extracted from their urine. It's a conjugated, it's an end product. So they were supplemented with an estrogen that is not native to their body. It has nothing to do with what the estradiol of their body looked like.
Exactly.
And probably that's why all of these issues happened with that study. So now, 20 plus years later, we have advanced enough that we know that we are able to give women estradiol that looks exactly or very similar, pretty much exactly, like the estradiol that their ovaries used to produce.
And it makes sense for it to be safer and have less side effects. Unfortunately, there are no scientific trials that compare those head to head, but from experience and from a lot of the experts out there, these hormones, women are taking them for years and years, and we're not having these complications like we saw in the WHI study hormone. And when this study came out, I was still in residency, and exactly like you said, don't use them or use them for a short period of time. Stop at the age of 52, 53, not more than 5 years. It can increase the risk of breast cancer. And plus, on top of this, we did not see many menopausal patients in our clinics, and we were not experienced in doing that. And it's funny, I was listening to a podcast the other day, a famous OBGYN. She was talking about her experience during residency. Also, same thing. She never got exposed to menopausal women. And on top of that, anytime a woman would come in and she's menopause, they would just ignore her, or just call her WW, whiny woman. So even the physicians or the new generation of physicians are not exposed to this, and we are one of them. But I think you can educate yourself. You can learn a lot if you dissect the literature. So estrogen, bioidentical. What about progesterone, and what about testosterone?
So we mentioned that these are the three main hormones that decline, and you can't just replace one and not the others.
Exactly.
So progesterone is important. Obviously, the progesterone also that was given in that study was not like the progesterone that our ovaries produced. So we should supplement with progesterone because it's a hormone. It has its receptors. It protects the uterus, but it also has so many benefits on the brain, cognition, the anxiety, the soothing effects of progesterone.
So the women who are out there that they've heard, probably if you've had the hysterectomy, you don't need progesterone because the progesterone is given to counteract. Is that true, or should they also get progesterone?
They should get progesterone. Okay. They don't have to take progesterone every day. Of course, every regimen is different, but one way is to do it is to give it in a cyclical manner, like try to mimic their cycle, how it used to go.
So even if you don't have a uterus, progesterone is still used. And of course, whenever you are taking hormones, there are other, we're going to talk about them in a second, other supplements that you need to help, metabolize these hormones and make them, function better in your body. Okay, so that's estrogen, progesterone. What about testosterone, which is, the male hormone? Should they take it? Is it bad? It's going to make them look manly, have hair, deep voice. I mean, because these are the legit questions that we
get all the time. The controversy now with testosterone, again, growing up and then in med school, testosterone was purely for men. Exactly. And it's a men hormone. It's not. You mentioned earlier, women have, compared to estradiol, they have higher testosterone in their body compared to the amount.
Yeah.
So it's a hormone that is produced in the woman body and it has a function. So although not all women are candidates for testosterone, the majority of women in their perimenopause and menopause would benefit from testosterone replacement.
Yeah.
We're not talking about replacing somebody huge amounts that they would have side effects, but of course in a
microdose
in a dose that's just enough to boost them, to boost their brain fog, confidence, energy level, libido, stamina at the gym, their muscle mass.
It's an amazing hormone, and really it's like magic. You feel this person is back to having life in them and being very, very functional. And like Dr. Yusuf is mentioning, and we repeat it again, hormone replacement are amazing. They're not for everyone. There is a lot of work now being done on genetic testing on people to exactly know how they metabolize their hormones, to see who's a candidate, who's at increased risk of cardiac diseases if given or not. So again, it's not for everyone, but the majority can take estrogen, progesterone, as well as testosterone. So now, how do we give it? Is it a pill? Is it a gel? Is it a patch? Is it a pad? I mean, or injections?
There are many ways that you can deliver them, from pill to the injection to the gel. Some routes are preferable to the others. For example, pellets, although, I get into this question all the time, are they FDA, not FDA approved? But they are the exact hormones that your body used to produce, and they're delivered in a different way. That's the only difference.
Exactly.
Instead of you injecting every week, you can put a pellet every few months. So that's one way of delivering hormones. You can put them you can deliver them in a pellet, or you can give estradiol with testosterone, and obviously progesterone. That it has to be taken as a pill, patch. And we have the pills, the newer generation that are not like the ones that were given in the past.
And the cream, which is one of the favorites. But again, I think like Dr. was saying, some of them, depending how the route is, you metabolize these estrogen differently. So again, it depends on the person's health, on their lipid profile, on their family history, maybe eventually on their genetics. And actually, the estrogen pill is has shown to be a little bit more protective for heart disease in women, but still the gel looks and will give you great results. And what about testosterone? How can you give testosterone also?
So testosterone can be also given in a form of gel,
or
injectable, or pellets. In my clinic, we use a lot of pellets, and that's also a preference for the patients because they don't have to get treatment that frequently. They come every 5 months and they get it done. We calculate the dose that they need to get, and they're extremely happy.
So yeah, I mean, you have to go to your physician, have a nice, long and, discussion about all these things. And actually, I was surprised when I was listening to that podcast is that, for example, in the US, some of the visits, or if you call it a menopausal visit, is not covered by some of the health insurances. Imagine, so they would cover a women exam, which is like a pap smear, and that's it. But they would not cover a longer discussion when it comes to menopausal symptoms. I was really shocked to hear this. Yeah. So this discussion takes time. I mean, we need to sit down and discuss all the options, see which is the best option for that patient.
There's thankfully, there's a lot of talk right now about menopause.
Yeah.
We're not looking at it the way we used to look at it in the past. Providers and patients.
Yes.
There's a huge of advocacy groups from both patients and physicians in order to promote more awareness about menopause and how we look at menopause and how we treat it.
One of the good things about social media now is like, these taboo topics are being talked about,
right.
And one of them is menopause, and there's more research coming out. So this is great.
Yeah.
This is great.
I mean, I feel guilty about the times that I did not treat menopause properly.
Yeah.
I was walking with my family the other day at a farmer's market. I was wearing my scrubs. I passed by a stand, and a lady stopped me, and because she saw that I'm an OBGYN, and she goes like, may I ask you for a favor? And I'm like, of course, go ahead. It's like, please treat your menopausal patients with hormones.
Wow. Yeah.
And she went and ahead and told me that she was ignored for such a long time, suffered with all these symptoms and hot flashes and vaginal dryness, etc., until she was able to find a provider who actually addressed and gave her answers and gave her treatment.
And there's I'm sure many women like her still, suffering. And, on top of, these hormones, being replaced and having a better life, of course, at the end, like Dr. Yusuf was saying, estrogen is all over the body, especially when it comes to the skin and to the fat and to the collagen production. So, women contemplating cosmetic surgery, for example, if their hormones are not optimized, they're not going to get a great result.
Right.
No matter how great your surgeon is, you might have a nice facelift for a few years, but then the skin will go back to being saggy and you're not going to be able to produce collagen. So this is also very important, for women. So, and you're talking about the farmers market, which I think you were going to buy some organic, vegetables and fruits. So how important is the diet when it comes to menopause? And what about other things? Sleep, exercise, supplements? Let's, talk about all of these.
So, of course, with the ovaries slow down, we have to replace, but that's not enough. We have to supplement with every possible avenue in order to get the best outcome. First is nutrition. Nutrition has to be optimal, an anti-inflammatory diet. We've spoken about this countless times about the importance of having an anti-inflammatory diet, but also what you consume and at the level of the macronutrients, which a lot of people ignore, is that when you're in menopause or perimenopause, you require a lot more protein than when you're not.
Exactly.
So your protein requirements are substantially higher. So special attention has to be given with every meal that a woman is consuming enough protein, good quality protein, coming from good sources. Obviously, optimizing at the same time sleep, exercise, and supplements. And when we talk about exercise, again, it doesn't have to be crazy CrossFit type of exercise, but it has to involve some resistance exercise. Because resistance exercise, whether it's cables, weights, anything that builds the muscle, any kind of resistance exercise strengthens two things in your body, muscles and bones.
And that's also where you need testosterone too, because this will help you build those muscles and the proteins, and by protecting or strengthening your muscles, you're going to protect your bone. Because if you get a fracture in your vertebra, it's going to be really painful. It's going to cause chronic problems. So osteoporosis is one of the things we can have another episode about it, but it's such an important aspect of a woman's life, because as we age, if our bone becomes fragile and we fracture a hip, and it's one of the most common causes of death and morbidity and older people. So that's good. The other thing we always talk about is the gut. So how important is the gut when it comes to the menopausal health?
Just like everywhere else, but because of the changes in the hormones and mainly estradiol has a huge effect on the gut microbiome. The gut microbiome, the type and the amount of bacteria in the gut changes. So it has to be special attention paid there with optimizing gut health by taking the right probiotics and prebiotics. Talking again about farmers market, my favorite thing in the form of prebiotics are fibers, sauerkraut, kimchi, fermented vegetables, kefir, all those to boost a healthy microbiome and keep, because the gut bacteria, they play a very important role in hormone metabolism and keeping the levels of the hormones where they should be. So, we go ahead and we replace somebody. We want to make sure that their gut microbiome is actually doing the right thing by keeping the balance of.
And not only that, I mean, the microbiome, they produce a lot of neurotransmitters, which is important for the mental health, which is also a challenge during that phase. Okay, so now we spoke about the gut, exercise, sleep. What about like supplements? Are there any supplements that need to be taken when you're taking hormone replacement, or are there any supplements that, if you're not a candidate for hormone replacement, that could help you also with some of those symptoms to go through that phase?
So if somebody is not a candidate for hormone replacement, we would want to tackle the symptoms.
Mm-hmm.
There are a lot of some natural, some medications that you can use, that we can use for hot flashes and for vaginal health. Of course, paying attention to bone health, calcium, vitamin D, a good multivitamin with probiotics. Vitamin D is essential, as we've spoken earlier about the hormone production and bone health. Of course, keeping in mind that not one thing is going to be
exactly
one lifeline. You need to have a multiple things
combination of things.
In combination.
One other question we got also about women that are not candidates for hormone replacement and they're suffering from vaginal atrophy. Can they use local estrogens or hyaluronic acid or anything to keep the vaginal flora healthy? Yes, even if you are not a full candidate for HRT, you can use local estrogen for a short period of time. It doesn't get absorbed into the systemic circulation, especially the bioidentical ones, and or you can use a combination with hyaluronic acid. Make sure the vaginal microbiome is also like at par, because otherwise it's gonna mess up all this. So again, supplements can be helpful. There are other options to protect your bones, to protect you from hot flashes, or a combination of things with the lifestyle changes.
There's a lot of devices that are out there that can help with vaginal health. But why is vaginal health important? Aside from sexual health, let's say somebody is completely not sexually active and they don't want to explore any treatment because of sexual health. But we know that in menopause, because of the lack of estrogen and vaginal dryness, there is higher chance of having urinary infections. Urinary infections can be deadly.
Of course.
Someone can die from a urinary infection.
They get into the kidneys, they get into urosepsis, and it's dangerous.
So, we see it quite often in elderly going into the hospital with fever, and they're confused, and we don't know what's going on. We investigate, and it's a urine infection that hit the kidney, and it's in the blood right now.
Right.
And most of those are preventable.
Exactly.
If you have a healthy vaginal microbiome that's not dry. So that's why menopause should never be ignored, because it is dangerous to ignore menopause, whether it's heart disease, sexual health, bone health, and so on and so forth. Now, obviously, the question is what will happen in the future.
Again, we spoke about the ovarian health is related to our lifespan and health span. So the longer our ovaries live, the more we're gonna live. And that's why whatever you do as a teenager or in your reproductive age group, it's gonna protect your ovaries longer, and then you're gonna produce more hormones, and your life and your cardiac diseases, everything's gonna go down. So there are some talks about using rapamycin, which is one of the medication used for transplant patients, to protect the ovaries, let them live longer. That way menopause age will be long, like at a later stage, and that way even the lifespan and health span will be better for women. Again, there's a trial going on right now. It's still in we don't have the results yet to see if this drug is helpful, but there are other things that are being looked at today to help protect the ovaries in order to prolong life.
You can't talk longevity without looking at the longevity of the ovaries.
Of course.
So
Yeah.
it has to go hand in hand because we know there is a sharp decline in health with the loss of ovarian health. So in the longevity world, all the preventative measures, all the supplements will have to target ovarian health
Exactly.
to keep women living longer, but not just living longer, living healthier,
Exactly.
longer.
Exactly. So I think, if we're gonna summarize things, don't ignore menopause. It's not, oh, you have to live with it and you have to suffer. There are options. Check with your healthcare provider. If they are not willing to give you hormones and you are suffering, try to find someone else. Make sure you are a good candidate. Make sure you know all your options, all the supplements. Again, everything goes back to your lifestyle. So concentrate on your sleep, concentrate on your exercise, meditation, lower your anxiety levels. Again, as much as possible. All this will count and will be like money in your bank, and it will prolong your the amount of money in your bank, and which means your health will be longer. So I think our message is talk about it and ask. I think that's the main thing.
If anybody is suffering with any of these symptoms that start early on, you're not crazy.
Yeah.
Don't let anybody get into your head and tell you that this is you're crazy. I was at a dinner with some OBGYN colleagues a month ago or something like that, and we were talking about menopause and hormone replacement, and I overhear some of the OBGYN providers saying that someone came in late into their menopause asking for hormones because they want to look younger and they want to become younger again.
Yeah.
And I overhear laughter, and the provider was like, "You don't need hormones. You need to see a psychiatrist."
Yeah.
This is a crime, in my opinion. Nobody should be treated like that, because we have strong evidence now that replacing hormones, tackling it early on, we can keep people living longer, healthier, prevent disease.
And it's never too late. You can still replace it, but of course maybe the effects won't be as strong as when you start early on. And I have a very similar story. I had actually a patient that didn't want to stop the hormone replacement, and the last time I remember I saw, she was like 72 and she was still taking it, and I freaked out because I wasn't aware that hormones could be safe. And she's like, I'm not stopping it, I feel great. She looked like a 40-year-old or even less, and she didn't want to stop it. I made her sign a consent every year when she comes in for her checkup that she's taking the hormones on her own responsibility, and she looked great. So it means there is something that's very helpful in those hormones. So talk about it. You're not crazy, you're not a whiny woman. These are real real symptoms that many women pass through, and I think it's a shame, and it should not be a taboo anymore talking about it.
Yeah. Obviously, a lot of people are now talking about the new ways of approaching menopause, and I'm so happy that everybody is tackling it, and a lot of women are being aware of hormone replacement, longevity, their options. More and more doctors should.
They are, but we need more. Because I think there's a lot of question marks out there, and then some people don't have maybe access to many other providers. They have their own doctor or physician that they've been following up all these years, and he's telling them or she's telling them don't take the hormones, and that's it. They stop there.
And I mean, women are loyal to their gynecologist. That's one important thing. But it's good to look a little bit outside of the box, see what other people are doing, see what your friends are doing, see what your family members are doing, read. Don't just assume that this is something natural and you just have to go through it, because yes, it is natural, but we're no longer living 100 years ago.
Exactly.
We have advanced quite a bit. We are living longer. We want to live longer, healthier.
One thing, maybe we forgot also to mention, like this is super important, but also we need to remind, women about, screening for, breast cancer, using their mammographies, having pap smears, doing, all the testing on a regular basis. This is also super, super important to keep in mind. And I think we can do another episode or another podcast about menopause, call it menopause number 2, because there's a lot of things we can talk about this phase of life.
I'm sure we would like to get your comments, questions. If you have anything that you want us to discuss about menopause that we did not address today, please let us know, and we would be happy to bring it in. Absolutely. There's a lot more to talk about menopause and perimenopause. Perimenopause by itself needs hours and hours of talking, because it's relatively new, because nobody paid attention to it in the past. Everybody said, just wait until things happen and then come back. Exactly. So bottom line, we have solutions. Menopause and perimenopause both should not be ignored. Hopefully we will be coming again with menopause number 2, perimenopause and menopause number 2, so that we can address more and more questions that people have. I guess with this we would conclude.
Yes, thank you so much for watching, and we're waiting for your questions, and we'll see you in the next podcast. Have a great day and stay healthy.
Thank you.